This information always comes as a surprise to people.
Health disparities. I'm not sure if I totally understand.
I think she's talking about health care.
What, like the whole universal healthcare thing?
Not quite.
I understand. We're talking about disparities in the quality of life, health, mental, and physical.
As it relates to race, environment, access, and socioeconomic status?
Yes,
Of course. But wait, we're talking about, like, Detroit, right?
And there is the surprise.
Well, of course we're talking about Detroit.
I'm not so sure. I mean, I have some cousins who live in Scioto Township, and things are pretty different there.
When people find out that there are huge disparities right here in Washtenaw County, things can become uncomfortable.
I've lived in Ann Arbor for 8 years. I did both my undergraduate and my graduate degree here. I think I would notice if these kind of issues were going on.
No, it's true. I'm a master's in public health student. I'm very familiar with the issues, but the issues, they existed over there.
Look at all the resources in Ann Arbor. Recreations, healthy food, good health care. How can it be disparities?
When was the last time you were in Ipsy?
Excuse me?
Or Manchester,
Lodi Township,
Celine?
York Township.
Augusta.
And that's what this whole health disparities thing becomes real. When we're not just talking about third world countries, we're not just talking about Detroit. Downriver, the far reaches of the UP.
We're talking about our neighbors.
Our families.
Our co-workers.
Our friends.
Our communities.
Right here in Washtenaw County.
And that's when we realize that this health disparities thing, it affects everyone. That the health and well-being of our state, our county, begins with the simple act of seeing each other.
Some things are easy to see.
I mean, going up and down Michigan Avenue, I'm always shocked by the number of empty storefronts.
I'm really starting to notice the foreclosure signs.
I don't even know people on my street anymore. People come and go a lot.
It's like we just can't get her well. It's like as soon as one thing clears up, something else happens.
I don't know how to explain it to you. I just feel exhausted.
And other things take more effort, a harder look.
You think poverty. And people get this picture of dangerous streets and project housing, and, something very urban. But rural poverty, you have to look really hard to see it. Not because it isn't there, just because it's, spread out, isolated.
Wait, but isn't poverty everywhere? I mean, it's this huge thing. What does that have to do with race or class or any of this?
Washtenaw County is one of the highest costs of living and one of the greatest income inequality levels in the state of Michigan.
Translation, it's hard to be poor here.
Families living below the poverty level in Washtenaw County are
27.4% black families.
Yeah.
22% Hispanic families.
5.3% white families.
So, health inequalities are social inequalities?
Social inequalities are health inequalities.
I think maybe, we don't see things because we're just used to them. I know I walk by that old empty Farmer Jack building all the time, and I never even think about it.
But how do we get unused to inequality?
That used to be such a convenient place to get groceries, fresh stuff. I don't drive and my bus lets out right there. Now there's a Happy's Pizza there. I guess that'll have to do.
We're essentially in the dark about what's going on right next to us. How do we turn on the light?
We ask questions.
Do I have a grocery store that I can walk to? Do you?
Where do you go when you get sick? When your kid gets sick?
What does it mean to be overwhelmed by stress? How has this affected our health as a neighborhood?
When you're faced with insufficient resources, how do you make the decision about what is a priority?
How can it be a group of people all living in the same area, the same county, have such different experiences?
What potential are we missing out on by being an unhealthy community? What could a healthy community be?
So we get unused to inequality by telling our stories.
Oh, I believe in God. Mm-hmm. I just don't believe he's on my side. Judge me all you want, but I don't know how else to explain this hand I've been dealt.
I don't understand. I did all the right things. I ate the best that I could, took care of myself and my family as best as I can. Why is my body working against me?
It was overwhelming. It was like all of these health issues were piling up. I was able to see a doctor a while back about the abdominal pain, but then it was my blood pressure, then my weight, then diabetes. I admit that I was avoiding these issues because they seemed so insurmountable with all the other things that me and my family were dealing with.
You don't understand. It's a cultural thing. Food is a cultural thing. Food is connected to tradition and family and values. Telling me to just eat healthier isn't as simple as it sounds.
I wanted to stay in school, but my dad was sick and I'm all he has. What was I supposed to do? It seems selfish for me to just leave him. That's not how we treat our family in my culture. School can wait, I guess.
Yes, okay, I smoke. I know it's bad for my health, but you know what? Everything is bad. I'm going under a lot of stress right now, and smoking helps me deal. Not smoking isn't going to magically make things better.
I had no idea that the effect of all of this was having on my health. I wasn't eating, I wasn't sleeping, I wasn't going to class, and it wasn't until I met with a school nurse that I realized that the bullying that I was experiencing at school was actually making me sick. I'm really grateful for her.
So we get unused to inequality by conducting and consulting research.
The average age of death in Ypsilanti Township is 66 years old. That's 8 years less than the average age of death in the Gaza Strip, 6 years less than in Vietnam, and 4 years less than in Iraq.
When we look at our drug court, the numbers indicated that we were more successful with African American females than with African American males. One thing that seemed key in successful cases was involved parents.
Low-income adults who have been threatened by intimate partner violence, IPV, are twice as likely to be diagnosed with diabetes than those who do not ever report being threatened by IPV. Stress and anxiety increase insulin level.
So we ask the questions. We tell our stories. We consult the research.
And then we find a way to make it all fit together.
We bring these issues close, pull them in, make them near, make them immediate.
People, power, place.
These aren't faraway problems.
And these aren't personal problems.
These are our problems. This is about more than living conditions.
These are our conditions for living.
In a world of broken promises, and in a world of shattered dreams, where everything seems to be what it is, and everything is not quite what it seems, you can lose yourself in the ecstasy.
I come to you today with a list of demands. I was told this is what someone was supposed to do when they are on strike. I am on strike from the reality of my health destiny, my lifetime minority status. The statistics show that as a black male living in this county, I may have less time on this earth than many of you. Less time to have a family, find my dream job, travel the world. Less time to make mistakes, and less time to fix them. Less time to figure out who I am. Less time to fall in love, out of love, and back in love again. Less time to change the world, to be the next great politician, artist, educator, doctor from Washtenaw County. Less time to be the next great anything. There are things I can do to help. I don't have to sit by and let this inequality take me over, but the reality of the situation means that my individual actions only count for so much. So I am on strike. I am on strike from a system that gives me less. I come to you today with a list of demands. I demand the opportunity to live up to my potential. I demand the opportunity to live. I demand my 26 years back.
I want more than 26 years. I want a lifetime, but not for me. I want it for the child that didn't make it past her first birthday. I want her chances for survival 3 times greater. I want the quality of her life to be determined by the tenacity of her spirit, by the fire in her belly, by the strength of her voice, not the color of her skin. I want my family to meet the girl who would have entertained them with her over-the-top stories and her vivid imagination. I want the teachers who would have had her in classes to feel the joy that she had for learning and the passion that she had for justice. I want our neighborhood to have known the girl who left home, did great things, and came back to challenge their elected officials, to care for their elderly, or to engineer their infrastructure. I want her drawings on the fridge, her angsty teenage poetry in the shoebox in the back of her closet. I want her sweaty basketball socks left on the floor. I want her college degree, her kindness, her potential to change the world. I want it all 3 times.
12 years. This is the tax on being poor. It's been 12 years since my father died. He was 53, and he died without health insurance. A diabetic with high blood pressure and an addiction to pain medication. He had a broken bone in his foot, but he couldn't have it operated on because he was too high risk, too low income. He had lost his job because he could no longer stand and work in the factory. He broke his foot when he slipped on ice on our front steps. Something so simple. Something that would have been a blip in the lifetime of someone who had the money to get it fixed. Someone who could afford the physical therapy needed to stay fit while they were recovering. Someone who could have been treated for the suffocating depression that comes with the inability to provide for his family. Someone who actually had the time and resources for a cardiovascular health plan. Someone who could have felt the heart attack coming. In these past 12 years, I have dealt. And I've done great things. And I have royally messed up. And he has missed it. And I am angry. Angry at him for being so unhealthy. Angry at him for being too poor to live. Angry at myself for blaming him for any of it. What could he have achieved with 12 more years? What could I have? What could my mother? I want 12 more years of having a father.
26 more years of having a chance.
A lifetime worth of years watching her grow.
We deserve that.
Someone like me, someone like me,
And I'm Jamera Jinx.
And welcome to
Gimme My Healthcare! The game where lucky contestants will navigate through the healthcare system to win fabulous prizes.
Woo! First off, let's see who from our studio audience will be joining us today.
That's right. And this is a reminder for our viewers at home. Our studio audience is filled with members of this very county in urgent need of health care.
Are you all ready to feel better?
Yeah!
All right, but not all of you will get the opportunity to play for your health and well-being.
That's right, Velma. Well, some of you don't even have to play this game.
Woo, that's right. Some of you get our fast track to health passes.
So, where are my friends making $75,000 or more a year?
Well, come on down.
It's only 1.5% of Washtenaw County residents making $75,000 a year or more have health are uninsured, that means you're all going to be feeling better in no time.
That's right. All right, kiddos, we have for you, in my hand, fast track to health passes, which include appointments with your primary care physician.
Full appointments.
The opportunity to seek a second opinion.
And referrals to specialists and access to ridiculously expensive supplements. So what do you say, friends? Are you all ready to get and stay healthy with our fast track to health pass?
Heck yeah! All right then, here you go. All right, you crazy kids, go get better. Excuse me?
Why are you still here?
Yeah, I think you forgot to give me my fast track to health pass. See, I really need it. I just don't have any.
Oh, this is awkward. See, you don't get one of these passes.
I'm a lawyer. I have health insurance. I'm rich.
Right, well, you see, it doesn't work that way. You have something that they don't.
What's that?
Check your pocket.
Racial discrimination?
I'm afraid that's right.
In the case of some health disparities, it is found that race is a bigger indicator than socioeconomic status. African Americans as a whole do not live as long as white Americans. Racism or racial discrimination actually affects the biological makeup of persons affected by it or living in a society where it exists.
So, Fred, you get our moderate speed to health pass instead.
Gee, thanks.
And now, let's start our game. Who's gonna feel better?
Let's see. You, what's your name?
Oh, hi, I'm Robin.
And what's wrong with you?
Wow, okay, well, I've been having these dizzy spells, these really bad headaches, some nausea, a couple other things.
Oh my God, stop talking, I'm bored.
All right, Robin, let's get you down here and get you feeling better. Let's give her a round of applause. Well, Robin, I've got in my hand a fast track to health pass.
Oh, great.
Yeah, great is right. Here you go. You do have insurance, right?
No.
Oh no, that's too bad.
Well, Robin, you've got a choice. You can either play one of our healthcare games, or you can suck it up and stay sick.
Play the game! Play the game!
Okay!
Suck it up.
I'll play the game!
All right, let's look at the big board. Let's look at the big board to see what game Robin's gonna play tonight.
Healthcare speed dating! This is a good one.
Like many uninsured people, Robin will rely on an ever-changing cast of emergency rooms, urgent care doctors, and nurses for her health care. This leaves little chance for follow-up appointments.
That's right, Jamera. People without access to healthcare oftentimes don't have the luxury of seeking checkups or routine appointments. So, that means that their healthcare issues will be dealt with by a variety of different people for a short amount of time, crisis to crisis.
I feel that.
So healthcare speed dating it is. Robin will have 10 seconds with each healthcare worker.
10 seconds?
Time starts now.
What brings you in today?
Well, I've been having these really bad headaches.
Have you ever had an MRI, an ANA, a BNP, an MRA, an angiogram?
I don't think so.
Do you wear glasses?
No.
Do you wish you wore glasses?
What?
You should get glasses.
But you didn't even give me an eye exam.
Here's a prescription for headaches.
Ding!
Hello, Mrs.
Just call me Robin.
Okay, Robin. Well, I want you to know that we are going to take excellent care of you here.
Okay,
we
good.
pride ourselves on excellent care at this hospital. In fact, if you will visit the gift shop on your way out, you will see our motto, our patients are our passion, on several mugs, bookmarks, and decorative spoons.
I don't really
I
need
want you to know that you will be heard, and we are going to work until we find a solution to that problem of yours. What is your problem exactly?
Well, I've been having
Okay, we're going to schedule some x-rays. Maybe you need glasses.
I don't really need...
Here's a prescription for the headache.
Ding!
The doctor will see you shortly.
Robin, I know this is frustrating, but we are going to get to the bottom of this, I promise.
Thank you. You have no idea how much that means.
Oh, no, of course, it's the least I can do.
Well, where are you going?
Oh, just to get the doctor.
Oh, you didn't think I was... I'm just here to empty the trash. Awkward.
Ding! There's no way that was 10 seconds.
Ding! And that is time! Congratulations, Robin!
So, Robin, tell me, do you feel all better all over?
No, not at all, actually. I have prescriptions for medications I can't take and can't afford, appointments for x-rays, some guy's fingerprints on my eyeballs, and I missed half a day of work. Great.
Great it is.
Can I just have my fabulous prizes now? Excuse me? Fabulous prizes. You said at the beginning of the game that we'd be competing for fabulous prizes. I competed against myself, so I'm pretty sure I won. Where are my prizes?
Oh, no. Yeah, well, about that was like 5 minutes ago. The rules have changed since then, you see. Now, in order to win the fabulous prize, you'll have to fill out these forms.
So sign here, 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 and here, make 3 copies and send by certified mail. P.S. They were due yesterday.
Well, how was I supposed to know the rules had changed? I was busy, playing the game.
Mm-hmm. Likely story. Bye-bye, Rob.
That wraps up right about... Wait.
Tamara, do you know what that sound is?
Oh, I sure do, Wilma. I think we have time for the lightning round!
In our lightning round, one lucky audience member will get to tell their healthcare story to our panel of judges. If they win over the panel of judges, their award will be a 1-hour appointment with a real doctor.
So, studio audience, look under your chairs to see who has the lucky star. All right, this is your moment. 30 seconds on the clock, please. Tell the judges what is wrong.
What is long?
Time starts now.
那你们可以帮帮我吗？我一直在咳嗽，然后晚上的时候觉得特别的不舒服，然后我觉得喉咙特别的干，然后有时候也觉得呼吸也特别的困难。Translator?
I doubt that. See, in many cases, people that rely on the emergency room for health care, they oftentimes don't have access to interpretation services.
This means that patients can often not describe their symptoms effectively, leading to incorrect disorder or misdiagnosis.
I think she said she needs glasses.
Oh, then glasses you shall have. Here you go. Another satisfied patient.
All right, that wraps up our game now.
All right, thanks everyone. Tune in next week to see uninsured patients compete to see who can stitch up their own wounds the fastest.
Fun. Have a tickety-boo day, and
thanks for watching.
Give me my healthcare! Show me ways to save my soul. Show me ways to save my soul. I got a hole in my pocket where it all slips away. Oh, I don't show me ways to save my soul. Show me ways to save my soul. I got a hole in my pocket where it all slips away. Oh, I got a hole in my pocket. I've got a hole in my pocket. Got a hole in my pocket where it all slips away. Oh, I've got a hole in my pocket. I've got a hole in my pocket.
Okay, Jorge, you can go ahead and start reading at the top of the page. Jorge. Jorge, out loud, please.
Man, forget this. I don't need this.
The high school dropout rate in Chelsea is 3.96%. In Ann Arbor, 7.26%. In Ypsilanti, 15.43%. And in Willow Run, 20.14%.
Okay, someone else then. Oh, yes, great, thank you.
We have policies in our schools that really limit our kids' abilities to successfully graduate.
No, sorry, I'm not feeling very good.
Again?
Yeah, sorry, I gotta go. Strict absence policies, for example. We had a young woman who was pregnant, and she missed her classes the first few weeks of school due to morning sickness. With so many absences, she was unable to get credit for the classes and was no longer on track to graduate.
Okay, then how about Khalil? Khalil Rewald?
Excuse me, teacher. Khalil's mother is sad. I mean, she's sick, and Khalil is taking care of her. They live by me.
Washtenaw County residents with less than a high school education have double the poor mental health days per month than those with only a high school diploma.
Okay, is anybody ready to start today's lesson?
It's simple physics.
So today we learn about Newton's laws of motion.
Maybe I just get it better than others.
Newton's first law. An object in motion will remain in motion until acted upon by an outside force. An object at rest will stay that way until...
Simple physics. Apartment to apartment. Relative's house. Friend's house. Our car. Every time my dad couldn't get enough hours, we were moving. 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 But always behind.
Respondents who moved for cost over the past 3 years were substantially more likely to report an anxiety attack than those with no recent housing instability.
Mi padre. He isn't exactly el padre del año. But I've never seen someone put in so many hours just to make ends meet. There isn't a lot of time that I can spend with my father where he isn't exhausted. Always moving, but never getting ahead. We do not talk about the problems that I'm having. What right do I have to bother him with my problems?
We have approximately 650 kids in Washtenaw County districts who will not be graduating with their class each year. This is about 1 in 5 potential graduates.
You know what they say about a rolling stone, right? Check out my lack of moss. Mi familia es pobre. Mi familia no es saludable. I'm an object in motion, desperately seeking an outside force.
44% of high school students with D's or F's were unable to ask their parents for help with their personal problems. This is compared with 18% of high school students with A's and B's.
If you want to know which kid's going to drop out of high school, ask the kindergarten teacher.
Newton's second law. Acceleration is produced when the force acts on a mass. The greater the mass of the object, the greater the force needed to accelerate the object.
Simple physics. The heavier the object, the harder it is to move. I can feel my heart racing. I can see my chest rising and falling. My mind tells me I'm racing forward, but there's this weight.
Son, I'm sorry your jaw hurts. Let me know if it's still hurting in 2 weeks. And maybe we can take you in, okay?
It was always like that. If I was still sick after 2 weeks, then we could go see the doctor. The time my jaw was hurting impacted wisdom teeth. Because I knew we couldn't afford it, I let it go for a year. I missed more school. My father became more distant. His mental health became worse. I felt like I couldn't breathe for fear of setting him off, let alone focus in school.
It takes a village, which is great if you have one. And we had neighbors, but we also moved a lot. And most of the time our neighbors had their own issues, you know?
34.7% of Washtenaw County adults making less than $35,000 a year disagreed that their neighbors helped each other out.
I grew up on a steady diet of frozen pizza, fast food, and hot dogs. It's what my dad could do. For the majority of my childhood, I was overweight. I was constantly picked on for that, or for not having the right clothes or nice things. I hated going to school. The weight, both physically and emotionally, made things so hard.
On the times I could ask for help, I did the best I could. If you are asking your neighbors to watch and feed your kids for you, you can't exactly expect babysitting in a 3-course meal. It was more like, hey, could you pick them up a Happy Meal or something?
See, I have the will to move. I have the motivation. Yo soy un buen estudiante. Yo soy inteligente. I'm putting in the work. I'm trying to graduate. But when success is measured on how far and how fast you're going, well, this wait, it takes a lot more acceleration to get me there. If I could only lighten my load just for a little while.
Persons without high school diplomas live shorter lives than those with high school diplomas. Graduating from high school might be the most powerful health intervention we can offer.
Newton's third law of motion. For every action, there is an equal and opposite reaction.
Every time I bounce from another neighborhood, another school, I bounce higher and faster and farther. The next time I bounce, I'm afraid I'll bounce so high up into the stratosphere where the air is bad and I have no control over my descent. I'll fall so fast, trying to hold on to whatever I can on my way down. My life, my education, slipping through my fingers. But what can I do? This weight, this load, it only gets heavier. I put out more and more energy to get me there, but this is the way it goes.
These are the laws.
Simples físicas.
Oh, you know that the strong gets more while the weak ones pay. Empty pockets don't. They don't ever make the grade. Oh, no, 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 no. Mama may, Papa may have, but God bless the child.
So here we are, back at the start. We've seen the effect health disparities can have in our county. We've heard the stories and seen the statistics. But there are many more stories out there.
More stories of trials and hardships.
But just as many stories of survival, of resilience, of transcendence.
All of our stories are connected.
Just like health policy is education policy, is environmental policy, is economic policy, is social policy.
The actions of one person can ripple out to a block, a neighborhood, a community, a city, a county, a state.
This ripple effect, it works on good stuff too.
Sometimes it can start with just one simple act.
Sometimes hope can be the best medicine.
Hey, how are you?
You know, getting by. You hungry?
Yes, actually.
Well, Brian next door, he's making his mama's tamales with some of the sweet potatoes that Jason grew in a milk crate on his front porch.
What?
I know, crazy, huh? But we're all gonna pull together what we can and meet over at his place. Do you wanna come?
Sure.
One simple act of coming together.
And part of coming together is seeing each other.
Hearing each other. It's sitting here in Ann Arbor and asking, why should I care?
I care because I want to live in a community where everyone feels healthy, feels free, feels respected.
And it's up to all of us.
It's about asking ourselves.
What do we want our communities to look like?
Health disparities were created, they can be eliminated by investing in our communities and in each other.
Investing in our communities for our communities.
It's like mi madre used to say, el pasto es más verde donde lo riegas.
The grass is greener where we water it.
People rise together when they believe in tomorrow. Change today to forever. This life keeps moving. People rise together when they believe in tomorrow. Change today to forever. This life keeps moving.
It's warming up. There it goes. Thank you so much, everyone. Let's give one more round of applause to the students. Thank you.